Well, psoriasis is a fairly common disease. We see a lot of that in our practices, and probably a good way to think of it is normally it takes your skin about 6 weeks to grow from the very bottom layer all the way to the top layer. In psoriasis, that's accelerated up to about 2 days. So your skin is just growing much more rapidly than it should, and it's causing a lot of scale to develop, and it's associated with redness and a rash that you see, but it's mainly just the skin is really growing far too rapidly. Psoriasis can affect people at any age, but it tends to be more common in adults. Most people who see that develop psoriasis are probably in their 20s, teens, sometimes a little bit older. And it just kind of comes out of the middle of nowhere. Sometimes people can be under stress and can develop. Sometimes people can get an infection, like sore throat, and they'll get what's called guttate psoriasis. You get a widespread eruption of lesions that develop, and usually that kind of goes away after a relatively short period of time. Most cases of psoriasis do tend to run in families. There tends to be a genetic relationship to it. So someone in your family tree probably had psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases. And for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.